goes down in March, and that will probably continue through the rest of the fiscal year. So we'll see some of the printing and travel expenses probably be under budget or not incur as much expense through the rest of this fiscal year. Any questions kind of on the full income statement or balance sheet that's popping out with anyone? We're still looking at we're focusing on getting a CART P&L that shows just CART stripped out from all the other activities. So included in the package was a CART financial through March 31st. We're still working with Financial One to help with some of the allocations of salaries. So where that's showing a net income of about 50,000, that probably will get adjusted as we look at some of these expenses and getting them properly aligned with true CART expenses, so we can show true CART revenue. So I think more to come there. I think we're going to just kind of fine tune that report, and I think it'll make it a little more useful going forward.
Phil, can you
so Financial
let
One,
me know if Sorry, Phil, can you let me know, did you guys apply for the PPP from
We
the
did.
government? And is there any
Jolie just, we had to send in some more documentation today to make sure we had all our T's crossed and our I's dotted in order to get the application submitted. So that's where we are in the process.
Okay. I was talking with a friend of mine over the weekend who has received that for his company. And I guess there's a very specific protocol we need to follow if we want to enhance, increase, best position ourselves for forgiveness. So if anything you guys need to get up to speed on, just let me know.
Yeah, and we actually received it. Liberation programs received those, the payroll protection. And to your point, Kevin, it is very specific. It's very simple, though. You have to keep your payroll, use it for your payroll, at least 75% over 2.5 payrolls, and cannot lay off or furlough any of your staff during a 3-month period. Then it becomes a forgiveness. So otherwise, it's just a loan. But again, if you've had impact on payroll, if you've had impact anywhere, it really is helpful. And that's just the key criteria, though, is just making sure you use at least 75% directly for payroll, and then it can be used for rent and other utilities and other expenses as well.
Phil, what was the amount of the loan we requested?
Jolie, do you know? Jolie's going to look it up. So we're using the chat box for everything we do. So watch the chat, watch us, and all that. So she'll look it up.
Yeah.
I don't recall off the top of my head.
Okay. Yeah, no problem. And then we have recently filed our 8-month report with Demas, and I know Financial One reached out to Phil just about some unspent funds, and I think coming up with a plan to use those funds and kind of where those funds will end up. Is that?
It is, but it was more talking to Demas and getting their approval to work with us to carry over some of those funds.
Okay. I think that's all I had kind of from a March 31st perspective. Anything jumping out at people? Any questions? Oh,
I
so
did
Jolie
raise my
just
hand,
posted
though.
the loan
Raise
request
my hand.
amount. Okay.
All right.
Oh, I see it.
You're so good.
In addition to payroll protection, are you seeking any funds through FEMA? Because independent of the payroll protection, if there's been any lost revenue directly as a result of COVID or any increased expenses, you can actually receive funding through FEMA on that. And the application's due next week. I don't know if you've applied.
We have not. And it would be, I think the only thing we could apply for lost revenue would be the training dollars that Mark mentioned earlier. So that would be it, because everything else is kind of grant funded.
These are government programs. I'm not sure personally I align with the criteria, but if they're out there and we can apply for them, I'm not sure why we wouldn't.
Mm-hmm. Making notes. Got it. Thank you.
I'll forward you the information, Phil.
Thank you. So, Mark,
Any other questions on the financial through this year so far? All right, Mark, I think we can roll into the audit firm discussion.
Yep. So we sent out an RFP at the beginning of April to 3 firms, 3 accounting firms, and that did not include our current auditors. So it's 3 additional firms that we reached out to. The RFPs were due back to us, or the proposals were due back to us on April 30th. We received all 3. We received a proposal from all 3 of the firms that we reached out to, and Phil had sent those proposals and kind of a summary sheet of the of kind of the key items from all the proposals. So we've gone through those. Phil and I actually had some conversations, and Jolie had some conversations with some of the firms, and we just wanted to kind of get a sense of anyone's questions or comments about the proposals. I think what we're going to look to do over the next week or 2 is reach back out to a firm and kind of ask more questions that weren't answered in the proposal, and just kind of get a chance to talk with one of the firms, and then I think from there the plan would be to have an email vote to approve a new auditor. So I guess I'm opening up to any questions or comments on those proposals that we received.
So in addition to questions or comments you might have,
Or Kevin, I don't know if there's
is there anything that you'd like us to talk with the audit company about when we do the follow-up conversations?
well, John raised his hand, so I don't think I'm the only one that can see you raising your hand, John. So
I was just
go
going to
ahead.
say that I know that we had, I like the side-by-side comparison, but I thought in the last board meeting there was a more frank discussion about a comfort level with one of the auditing firms that actually embraced and understood the mission of CCAR. Unless I had that wrong.
I think that referred to
That was
the marketing firm we were working
So there's there's nothing that distinguishes one of these audit
so.
firms from the others outside of price?
Well, I can only say that one that came in at the lowest price, Whittlesey. Yeah, Whittlesey came in
Yeah, I think
at the lowest price, and they were our former auditors. They Mark Barzattini worked for them, then moved to this current firm, Pew Chick, and he was our auditor. But this last year we had a new guy. Mark was still at the firm, and that's when it kind of went south on us. So, but we have been with Whittlesey before, but other than that, I don't have, the CCAR staff doesn't have any personal relationships with any of the three, or know of them.
For Mark. Mark, this is your wheelhouse. Would you have a strong recommendation of one over the others?
Based on firm alone, I think they're all very capable of doing the work. That's kind of why we picked these three. So I would be comfortable if we had to pick any of these. I would be happy with any of these selections. So just from a firm standpoint, I think they're all good choices.
So hearing no questions about the work that's been done so far in the RFP results we received, Mark will take the next step and set up a conversation. Phil, I think you're going to attend, and Jolie, I think you are as well. I'm happy to go if you want. So I'd like to know if the board is hesitant at all about that next step, and in addition, are you okay with an email vote depending on the outcome of the further research that's going to be done? So, Ann, you're on mute. Yes.
Can you hear me now? Like that Verizon commercial. Okay. So to answer your question, I'm okay with an email vote. I am curious. It sounded like you mentioned something with one of the firms had gone poorly in the past, and I was curious about that.
So one of the firms we had worked with before, and we actually had really good results with them. It was a certain individual, Mark Barzattini, worked with them. Then we went with Mark Barzattini, switched firms from Whittlesey to the current firm, Pew Chick. And then Mark, for some reason, did not handle our account this last audit, Mark Barzattini. And this other guy, Jeremy, did. And that's when it went south. And that's why we're looking for a new audit firm. So with Whittlesey, we had a really good experience for the years we were with them. Does that answer your question?
It does. I think when it went south, I'm not really sure what that means and why then they would still be in the running as or.
Yeah, so no, it went south last year with the firm that we are not working with anymore. That's why we did the RFP.
Okay. And Mark Whittlesey is with one of the new RFPs.
Mark Barzattini was with Whittlesley. So 5 years ago, our accountant was Whittlesley and Hadley. Mark Barzattini worked for them. Perfect service. We moved to Pew Chick and whatever their name is when Mark Barzattini moved with them. So we went with Mark Barzattini. He did our audit for 4 years. Then this last year, for some reason, he was no longer our auditor. And that's when we had a bad experience. Mark Barzattini is not even in this anymore. So he kind of, I don't know what happened. And I could have pursued it more, but because of some counsel from board members, I just said, I'll zip my mouth and be quiet for a while. And we'll go look for another firm. And that's what we're doing right now.
That's helpful. I appreciate it. I was just a little confused with why someone from the past that was not good is in there. So that makes sense.
Okay, good.
Appreciate it.
Yeah.
Any other hesitations about this process moving forward or our engagement in it through a vote coming up? All right, sounds good. Thank you for your feedback. So Phil, I think the rest of the agenda is yours.
Okay, so quickly, I did send out a board update this afternoon or this morning. If you got that, raise your virtual hand. So I like to keep people, did you get the board update? And did you actually read it? What do you, but I'm glad you got it. So this might be repetitious with a little bit of this. So the first one is our virtual status. So since we've gone virtual, working at home, the staff have been outstanding. I mean, just far and above what I could have expected. How do you keep a recovery community center open virtually? And they've managed to increase their activities, reach out to volunteers and recoveries. I think last month I put the number of Zoom meetings that we were able to do, all recovery meetings, something like 72, I think. I'm not 600 something participants. So I'm really pleased with that. Volunteer Recognition Week, they did a virtual dance party to close it up, and they're going to do that every Friday. And then the emergency department, there were at the end there were people that would still have gone into the hospitals and some people that would never have gone into the hospital. So those were our coaches, but they're still receiving calls. It dropped from about 100, around 100 to about 60 to 65 each week. So the volume isn't there, but they're much more thorough. They're following up, and they're doing it by phone, so telehealth kind of telecoaching. And they're still getting excellent results, getting people into care. And they've also had the opportunity to do more telephone recovery support and more engagement of people they had talked to in the prior 3 years. So they've reached back and talking to a lot of people and really providing that coaching recovery support. So I had a conversation which goes into number 4, DEMIS funding. But does anybody have any questions about how we're operating virtually, or any questions at all? And if you do, you could also type them in the chat, and I'm more than willing to look at those and answer questions too. And if you, or raise your virtual hand, either or, and I'll get to you, I promise. So I had a conversation with DEMIS about how do we stay open virtually, and are you okay with that? And this is what we're doing. And it's funny how things kind of get transferred along the loop, but I was saying that the coaches, recovery coaches, had the calls had dropped slightly, like 30%, 40%, but they were still making calls and doing a lot of work. And somehow that got, by the time it got back to me, was that the emergency department coaches don't have anything to do. and that's not true. And so we were able to talk all that through, and right now, Demas is good with us paying our employees and not furloughing them and not putting them on leave, so that's really good news. Any questions about that? But it took a few go-rounds and clarifying what we're doing and providing some documentation and all of that, and they're okay with that. All right, seeing no questions, nothing in the chat box. John, what's up? Don't forget to unmute.
Yes, I got it off. Sorry. With regards to the idea of Demas having furloughs and layoffs, again, that would impact the payroll protection program. It would compromise the ability to have that forgiveness. Is there a way to communicate that to Demas, or at least, or maybe let them know that that would be something that would really hurt the whole payroll? I imagine that number that Jolie had shared is the actual payroll number, so any reductions could compromise the forgiveness loan.
Right. So Demas is not Demas is telling us business as usual. That's good for us, right? Yeah. And I don't have any plan, because we wanted to be good stewards of the money and be very transparent, let them know what was going on, and they think keeping people employed, as long as we can find them a meaningful work to do, that we were aligned with our goals. So they wanted to keep our people employed too. Yeah, thank you. Which, and Jolie might be able to speak a little bit to this too, but this actually, Kevin brought this up in one of our conversations about what would it look like when we reopen CCAR, right? And the emergency departments are one thing. Hospitals might have some protocol that we have to follow, those kinds of things. But when you look also at the recovery community centers are really our big area because we have 5 of them. What would that look like if we reopen, and establishing some protocol and best practices and cleanliness and all of that? And then our administrative offices, we're separated more and can do the social distancing thing and keeping things clean and all that a little simpler. And we also have more flexibility for people who aren't fully comfortable with coming into work in our administrative offices to work from home when they need to, and there's also kids and families to think of. So I'm also interested from some of you that are going to be opening and returning to work, any guidelines that you might have or any thoughts at all about reopening. And it could be as early as what? This is the 4th, less than 3 weeks. Who knows? So and it's been a topic of our leadership discussions and staff discussions so far, to really think about what that would look like. And if anyone wants board input, you can type it in the chat box because I'm recording the meeting, or send me something email-wise, anything you found, a website, anything like that. So I just wanted you to be aware that we are definitely looking at it and considering it. All right. Yeah.
Bill. So if we're, say if the governor reopens things on the 20th, are you, I guess, what would you be going back to 21st, or is it like, I guess timing wise, how soon would you open up kind of the centers?
So we've always followed, like, it's kind of funny, when the non-essential state employees are told to stay home or told to go back to work, well, that's kind of where we have aligned ourselves with, like, snowfall and those kinds of things. So if they said non-essential state employees return to work, we would return to work, and Mark, it could be the next day. It really could. So I think we have a whole staff check-in on Friday mornings, and last Friday we asked them to start thinking about it, and this Friday we'll bring it up again. So we'll see, though. There's so many questions with all that. Joey, I'm going to put you on the spot a little bit to think about some of the steps you've taken with your staff and what we're doing as far as preparing people.
Hey, sure. So we've had conversations, as Phil mentioned, at our virtual staff meetings on reopening. And, simply just putting it out there. When are we reopening? How do we reopen? What does that even look like? So I want staff members to start thinking about that for each of their departments. And we're going to schedule team meetings with each of the departments to find out what their thoughts are. So far, feedback is all over as expected. We have staff members that can't wait to get back in the hospitals, and start coaching again. And then we have other staff members that are still not comfortable being in an office environment and interacting with people, which is understandable. And then we also have staff members that have little kids, and due to schools being closed, possibly for the rest of the year, what is that going to look like for them? So I have attended a couple of HR roundtables, and one of the things that they mentioned was that, for example, employees must wear face coverings. So, we're already in the process of ordering masks and just making sure we have that on hand for staff members. They also strongly encourage increased sanitizing practices in all of our locations. So we have to look into, purchasing those types of supplies. They are also recommending by CDC guidelines to conduct regular temperature screenings. So, and that comes into the question of who is going to conduct temperature screenings. Is there going to be a designated staff member at each location doing that? What does that look like at the centers? Is the staff member going to be standing by the doors screening people as they come in? So these are all things that, we're currently thinking about. They're also recommending that we continue to have a flexible telework, option for staff members who, especially our administrators and work at offices and stuff like that, to continue, having that accommodation in place with everything that's happening right now due to COVID. So these are the things that we're discussing at a leadership level, and also we're looking forward to discussing it with staff members as well. But the main thing is we want to make sure that, we look out for the health and well-being of all staff members, and that they feel comfortable with whatever protocol we have in place.
Thanks. So I just wanted to update you on that. And again, we're open to any feedback or any resources that you want to point us to as we consider reopening. So with COVID and this whole thing, yeah, John.
Just from the standpoint of Jolie mentioning the temperatures, we actually just had we have a regular meeting every day with our senior leadership because we're dealing with real-time essential workers and remote workers. And our medical director has given us a new protocol on the thermal temperatures that are self-screening. So to your concern, Jolie, you can't have somebody else do it without contaminating themselves, right? So it's unless you have a piece of plastic, as they do in the hospital for the infrared, it goes through the plastic, and then somebody else can do it. But they are our medical director, and who works at Stanford Hospital, which was like the epicenter in Connecticut, recommends a person doing it themselves or temperature and trying to give themselves a temperature if you don't have the thermal before they come to work. But now we're actually implementing for employees when people come to work to take the temperature in real time for each one taking it, because we can't tie up our medical staff, so people have to take it on their own.
So that's concerning when we think about the flow of the people that come into recovery centers who are looking for services. It's challenging to think about having people come in that might be ill.
Yes. Any solutions to those challenges?
I really thought there was something you could point at your forehead and it would tell you whether you were sick or not, but apparently, John, that doesn't exist, right?
Yeah, no. No, and again, just to emphasize, this is for our employees. If a recovery is under the weather, we will give them services curbside or even at home. But for the staff, we have to show that we are protecting our staff and keeping them safe and helping them keep the recovery safe by them doing the thermal temperatures. Not only at request would we be doing that for the recoveries if they felt they had a temperature. Not for everybody coming in the building at this time.
Yeah, Maggie also says that in the chat box that we can also share the self-screening questions from docs. So there's some self-screening questions as well. So maybe that is something to we could have at the center door or out, I don't know. Yeah, these are we've got to figure it out.
So I think one of the things we have to be cognizant of, and certainly I've experienced this in the few conversations I've had, some people think that COVID isn't as bad as other people think it is. So we may have recoveries or even employees who are thinking, you know what, this is really overblown. You know, I had a old farmer in town tell me that, you know, this is way more, we're making a big deal out of something that shouldn't be a big deal of. Now, as a person who looks at the news and understands statistics, I think they're wrong. But we could have recoveries and employees coming to work, coming into our places that just shouldn't be there.
Yeah. So it's an ongoing discussion. You can count that I would definitely draw the board in on some of these tough questions like what does it look like when a recovery center opens, and I would run the protocol, I think, by all of you just to see what we're doing and how that would look like to get feedback. I think it has to be more than just the leadership team. I think you guys need to be aware of what's going on because it's just it's kind of unprecedented water, and we just need to work together to come up with the solution we think is best for everyone, right?
Sounds good.
Okay. Let me see if, all right. So on the other, there's a few things we've learned that I was able to do and I'm talking about online learning opportunities, and I did the Recovery Coach Academy online to like 39, 40 people, and I did it with Sandy, my wife, and it was a remarkable experience for a variety of reasons. One of the things we really learned is that some people are much more prone to learn well without the distraction of being in a room with other people, whether it's just they don't, they're more comfortable, or body image even, or other distractions. And so there's a real call for people to learn online, and we used a lot of the chat box, and we used hand raising and cameras and microphones and breakout rooms and one-on-ones all through this Adobe Connect platform, which really can do a lot of really incredible things. So there's a tremendous opportunity for us to grow our online learning department, and we don't have the capacity to do that. Even with Stacy, the wizard, and her incredibly sharp mind and her 4 staff people, we have determined we need someone to build out the online learning and take, kind of lead that. We're working on a job description, and I just wanted to put that out there to see if anybody had any thoughts or questions about that. And when you think about it a little bit, it's also not only, and you say, well, how can somebody recovery coach from virtually? And they can now because we're doing it. We have all these telehealth opportunities. So I think there is going to be such a thing as online recovery coaching. We're experimenting with Live Loud and the O'Donnell Company about serving as the recovery coaches for the live chat. Yeah. What do you guys say, John?
So I know we have control over the Recovery Coach Academy curricula, but I do understand there are other entities that are putting this online Recovery Coach Academy online. So I'm wondering where we're at with understanding that there are other states, for instance, doing it, and is there a, uniformity of what would actually be the best format for online versus in person, and how much say do we have in that, or have we lost control once it becomes an online product?
Great question, and we've been struggling with that since it all started. So we have developed an entire protocol that if you're going to run a CCAR curriculum, that you have to submit how you're going to facilitate it, what it's going to look like, what the process is. And so, and people have submitted their requests, and they seem to be doing okay with it. Well, we really lost control of the face-to-face, too. We could never ensure fidelity or quality according to the trainers. So it's kind of making us rethink a lot of things about how we do online training and who gets our manuals and how and who trains trainers. And so it's always a struggle about how much you let people do and grow their business, if you will, and help us with our business. But to us, it always comes down to the bottom line. What is the person's experience that's taking the Recovery Coach Academy or learning to be a recovery coach? That is the bottom line. And are they getting the best training that we feel they can get? And so that's what we're always trying to anchor ourselves in that philosophy. And so far, people are learning to do things, especially through Zoom. There's some problems with Zoom, and one of them being the Zoom bombing that was talked about earlier. But there are ways to control that, but it's not as flexible as Adobe. And I think people far underestimate the amount of work it takes to prepare for a virtual training experience, and they underestimate the role the producer, the person that's moving the chat boxes or taking care of the technical issues or, the pods that you see on the screen here, because those can all change and switch and breakout rooms. And the role of the producer is almost as important as that of the facilitator, if not as important. So we're learning all this, and we're learning quickly, and we're full. The training team has been full out working to develop training. We did the Recovery Coach Academy. We've done ethics. I'm doing the emergency department and spirituality in the next couple of weeks. We've done recovery basics. So the opportunity to deliver this will also, if we develop it, will have much more of a reach to audiences that we haven't been able to reach before. And also think about where it could go globally, with some language translation and the access other people would have to it. So the opportunity there is just incredible.
Thanks, Bill.
You had me talking a lot more than usual. I don't usually talk this much, but
and then why, just a follow-up question, Bill, for platform, why Adobe over Microsoft Teams? We actually started with Adobe
probably 2 years ago after researching all the different software platforms out there, and our consultant at the time that went through the process, Sandy, was very well versed in Adobe, and to do the kinds of things we wanted to do in a virtual setting with different time zones and all that just seemed to be a very user-friendly tool.
Thank you.
And I can't say that we went side by side with Microsoft Teams with Adobe. It was just one that we've chosen, and one that you work with more and more. You can see that it's really flexible and does really good stuff.
Thank you.
I think you have a good point, John. These technologies change over time, and I'll date myself a little bit. The first word processing program I used was Multimate.
Oh, yeah.
Of course, Multimate doesn't exist anymore, so I would suggest that as part of this process that, we take another look at technology, and that is not something that we do just now and then forget about for 5 years. I think, especially when it comes to online and driven by COVID, that would be part, I think, of the responsibility of this person that Phil is talking about.
Yeah.
When I spoke with him, I thought the potential for jumping on this now was really pretty important, because we could wait until COVID is done sometime next year and think about what to do with online, or we can get behind it now. We can invest now and get ready and up to speed as quickly as we can. Phil talked about the international markets that could come. I think about the markets here domestically or even in North America, people that would like to attend but can't afford to and are too far away from any of the rest of our trainers to attend something more locally. It just opens the door wide for all kinds of potential business that we don't have today.
I agree.
So any concerns about, if this goes forward, we're really investing ahead of revenue. So we don't have revenue currently to support this position, but we would think, as I talked about it with Phil, we would think within a year that person could cover their own salary with profit that comes in from their work. But before that, we'd be investing some of the discretionary funding we have to support this work. And we might also use this as an opportunity to do some unique fundraising to try to go out and get seed money to get this position funded for a year from a company or companies who can understand the value of what that might look like.
Mm-hmm.
Much more difficult virtually, Phil, to understand and see body language, but it sounds like we're good to go.
Well, if they agree, they could raise their virtual hand that they think it's a good idea. If they don't, well, I don't know. So we got someone hand raised her hand, Cheryl. Okay. John and Kevin, they all raised their hand too. Leave it to the treasurer to not raise his hand. He's like, nah, I don't know about that. But that's okay too. Benefits update. So we used to have a plan where, Joey, what was the percentage we upped the percentage that of salary to go to benefits? Is it at 13 or 15? I can't remember. And she's giving me the answer. 13. Used to be 13%. And so if you waived medical, you could use 13% of your salary to go into 401k. And our conversations over the last few months with our benefits people have been to not do that anymore. And so we've worked with Chris O'Neill, who's out of AIM Insurance. He's just a remarkable individual. And we're going to move the health insurance to 80% employee, 50% spouse, 50% family that we will cover. They will have a choice of 3 plans, kind of middle of the road plans with Harvard Pilgrim Health. And we showed that to the staff last week. They were good with that. Then we will separate out the 401k donation and make it more standard, like for other agencies, and we will match 50% up to 8%. So if someone wants to put in 8, we'll match up to 4. We'll match 4. So I just wanted to say that we're shifting the benefits, who takes what, who does what. We should be good as far as cost goes, keeping it in that same budget number. But we'll see who enrolls differently and what people take advantage of or utilize. Did I miss anything, Joey? Was that a good summary? Any questions about the benefits update?
No, just a comment that 50% for up to 8% is very generous. It's very good. I very much support that. Most nonprofits, it's generally 50% up to 6%. So that is actually quite generous.
Thank you.
Yeah, Phil and Jolie, I appreciate you bringing us in line with other nonprofits. I honestly didn't know about the 13% if you waive medical. That's on the too generous side. So I appreciate you balancing this out. Good work.
Yeah, and I think that one of it was raised. It's not a legal issue, but it might be kind of it could get sticky if it's almost like you're incentivizing someone to waive medical so that they can put the money into their 401k. And we just wanted to keep the two completely separate. This is what even if you waive insurance, you're not gonna get a benefit if you waive the insurance now at all. But we will still contribute to your 401k, much more equitable, right? So this EDRC, data analysis, Emergency Department Recovery Coach program. Rebecca asked me this to talk to the board if we know of anybody that we could pay to take our data and analyze it and generate a report. Because we cannot get anything from Yale. They're state funded. They're dragging their feet. They have their own emergency department program. So we are looking for names or firms or ideas that we can work with to get all the data that we've collected almost over 3 years and get somebody to analyze it and publish a report. I think it's necessary for the field. And so this is where you guys chime in. I'm open to ideas here. Chat box, raise your hand, speak. Excellent, Ann. I appreciate it. We talked a little bit about working with UConn too, where the team, if you get into their whole research department and all that, it's pretty cumbersome. And we're more interested in somebody analyzing the data we have instead of like running, this group and the control group and a clinical trial and all that. Let's just take a look at the data we have and see what, if any, conclusions can be drawn from it. Yeah, John.
Brett, the first lady of Yale, right? Isn't her husband the president now? Is that a conflict?
Yeah, but I can talk with her. I haven't talked. She used to do some of our data before, but I don't think she's doing much anymore because she is the first lady of Yale. Do you know if she's still working? Is she still doing it?
Still doing that.
Okay.
Because I know she's known quantity.
That's a good idea.
In the past, right? I've used it in the past as well, and so is Asher.
Mm-hmm. Asher's used MARTA.
We use a group out of New York.
Good. I'll see. Well, can you forward that information along to us too?
Heidi Arthur, her name is. Health Management Resources, I think they're called.
What is
Heidi
it?
Arthur, Health Management Resources. Do you know her? She
No, I don't.
I'll forward you information. I
Okay.
forwarded you some other information earlier, screening tool and the FEMA stuff. Be in your emails.
All right, good. Thanks. All right, and if anybody has any other ideas about that, greatly appreciated. Dr. Emily Hennessy is a researcher. Oh, good. That sounds interesting too. Thanks, Anne. I'll pass these on to Rebecca. Good. So one of the ways we've been in touch too is the 5 people in the leadership team, myself, Jolie, Stacy, Rebecca, and Michael Askew. We're up to 47 staff people, so we have roughly 5 groups of 8, 9 people, and we call them every week, and we rotate the groups to check in with them to see how they're doing. We've got a variety of responses, and we discuss those at our leadership team meeting. We also have a virtual staff check-in every Friday morning at 9 a.m. and just to hear how people are doing. And we've covered some topics like what's it mean to be, the skills you need to be a remote worker, what's it like to work from home, what's it like, how to best set up your camera to be on a Zoom meeting, those types of things. And then we just check in with them to see how they're doing, and people give us honest feedback and they share with the group, and it's been very good. So I conclude that just to say that we are doing our best, or trying to be creative and innovative to stay in touch with all our staff and what they're doing, and encouraging them to stay connected to others as well. And then finally, the last piece is the Ocean Recovery Community Alliance Coordinator position. Jolie and I have had 2 interviews with an amazing candidate. He's in recovery. He used to work at Newport Academy. Then he got hooked up with Timmy Walsh at Adventure Recovery. Worked there for a while. He's a recovery coach now. And he moved from Northwest Connecticut to Rhode Island, actually near where I am right now, in order to surf and do recovery coaching. He's already involved in beach cleanups. He's a member of the Surf Riders Association. And so we checked all 4 references. We're going to offer Kevin a position. His name is Kevin. We're going to offer him a position and probably start him in June to do some of the organizing behind, and then seeing where this is going to lead with beach cleanups and all of that. So I just wanted to keep you posted that that is moving forward. Incredible candidate. So it was like he was made for this position. So we're excited about that. We'll see where that goes. Any thoughts or any other questions for me? Julie, anything you want to add from your end that we think the board, anything the board needs to know or ask about? All set. All right, so I don't have anything else, Kevin, unless you have any questions for me.
I'm all set. I've learned through my work at UConn recently that about an hour is about as much of any of these Zoom meetings as any of us can handle. So thank you for hanging in there for 75 minutes. If we're in a very unusual time, I don't need to tell you that. If you have something you want to talk over with Phil, some idea that comes to mind, if you, as he said, come across resources that might help us as we reopen centers, or just want to have a conversation about that, don't hesitate to reach out to him. He and I talk more now than we used to in the past because things are changing so much. So it's not more than 2 weeks before we're on the phone with each other. And the same goes for me. If you have concerns, something you'd like to chat over with me, just don't hesitate to reach out, because if we all lean in together, we're going to have a much better outcome than if we do our stuff individually. So, anything else before we wrap up today?
I have one more thing. I just wanted to acknowledge the work that Mark did in securing the RFPs and getting those. I mean, I was kind of blown away to see like a 50-page proposal come in, and and without his help, I don't think we would have got this far to ask the right questions and to have a range of like from 18,000 to 23,000 to 28,000. I'm so glad that he's our treasurer, and thanks for your work there. Very appreciate that.
Yeah, great work, Mark. I think I took you a little bit for granted there, because you're always point, and you always have stuff handled. But thank you so much. Anything else this afternoon? Thank you for your note, Maggie. All right, so as I try to end up or make sure I communicate in all my messaging, stay well. It's important. So thank you all for your time today, and we'll do this again.
Thank you. Thanks, Kevin.
Thank you. Take care.